Welcome to the Axis Soft Tissue Seminar. My name is David Brentnell. I'm a specialist musculoskeletal physiotherapist from Brisbane, Australia. In the next few minutes, you'll learn what occurs when you have a soft tissue injury and what you can do to assist your own recovery. Soft tissue injuries affect most of the population in one form or another most months. A soft tissue injury can affect muscle, joint, ligament, cartilage, tendon or connective tissues. This includes the discs of the spine. Some examples of soft tissue injuries include ankle sprains, a pulled shoulder, a back strain, and an overuse injury of the wrist. Sometimes you will hear people refer to this group of injuries as sprains and strains. If you have a work-related injury, soft tissue injuries make up the most common type. Soft tissue injuries do not include serious pathology such as cancer and infection, nerve damage or broken bones. As you have learned, a soft tissue injury may involve a number of different tissues. This means that the term is frequently used. In many cases, the specific tissue responsible for the pain cannot be identified with certainty. An example of this may be an injury resulting from dropping a box on your foot. There could be bruising to the muscles of the foot and a sprain of the ligaments. Let's begin with something to get you thinking. A soft tissue injury refers to injuries of muscle, joint, ligament, cartilage, tendon or connective tissues. True or false? A soft tissue injury is an injury to muscle, joint, ligament, cartilage, tendon or connective tissues. It's not a bony fracture, tumour or infection. Some examples can include knee strain, tennis elbow and mild whiplash. Finding a single tissue which is causing symptoms by performing scans, ultrasounds and x-rays is usually not required to effectively treat a soft tissue injury. It is important, if you have hurt yourself, that your doctor or physiotherapist rules out potentially serious causes of your pain, such as nerve damage, tumour or infection. Once these serious causes have been ruled out, then it is likely that your condition falls into the category soft tissue injury. Here's another question. Soft tissue injuries can initially be quite painful and debilitating. True or false? That's right. Soft tissue injuries can initially be quite painful and debilitating. The good news is that they usually resolve quite quickly. Interestingly, the amount of pain associated with these injuries is not a good indicator of the severity of the condition. That's the funny thing about pain. There are many stories of athletes of all levels of expertise tearing a muscle in the process of scoring or kicking a goal and reporting that they did not feel any pain until the points were scored. Sometimes a minor injury can be extremely painful, such as a blister from new shoes. People would have experienced high levels of pain only to remove their shoes to find a small blister on their foot. Some more good news about recovery from a soft tissue injury or sprain or strain. Your body is always prepared to call upon the healing process. Let's use an example of a ligament strain in your back. It's just that, a strain of the tissues in a ligament or even a disc. These soft tissues may be pulled or overstretched, but the body responds immediately and sends healing cells and nutritional fluids. In fact, there may be so much extra healing activity that there may be swelling or warmth in the area. This is normal. And as we've previously mentioned, pain is common. Pain helps us mildly reduce our physical activity to assist in the healing of the strain. Studies into ligament healing show that too much physical activity can slow healing, but importantly, too little physical activity can also slow the healing process. By staying active during your recovery, you'll allow your body to heal quickly and efficiently. This will also prevent you from losing physical condition. It has been shown that early return to work is a key factor in a successful recovery from a soft tissue injury. In some cases, it may be necessary to temporarily change your work duties. Ask your doctor about returning to work as early as possible, and you should return to your home and recreation activities in a sensible manner as soon as possible. Remaining active when compared to immobility has been shown in some studies to heal the injured ligament in a stronger manner. It is thought that moderate levels of activity, such as modified duties at work or modified sports training program, stimulates by gently loading and stressing the healing tissue in a positive way. A review of a collection of studies has shown that the maximum period of bed rest following a back strain should only be 24 hours before gentle and progressive return to physical activity. Only 24 hours, so a return to activity and work is likely to occur before pain completely ceases. Let's have another quiz. Research shows that resting in bed for about a week can assist with recovery. True or false? Research shows that resting in bed for no more than 24 hours is the optimal period of time for recovery. By being active and performing some gentle exercises during your recovery, you will allow your body to heal more quickly and efficiently without losing physical condition. Here's one more question. Waiting for all pain to completely go away before resuming usual activities can improve recovery. True or false? The answer is false. It is better to return to some activity before your pain completely resolves. If you have sustained a soft tissue injury, you may be under the care of a doctor and perhaps a physiotherapist. As we have said previously, it may be important at the early stage to rule out serious injury such as bony fracture or tendon rupture. Your doctor may also suggest appropriate pain medication. The physiotherapist may provide treatment such as education, joint mobilisation, gentle exercise and strapping or crutches. There may also be other important people involved in your recovery, such as your coach or trainer or an insurance case manager. The most important person in your recovery is of course you. So what can you do? Firstly, it is important that you report injuries or persistent discomfort to your employer, coach or trainer immediately. It has been shown that early intervention will speed up your recovery. Generally speaking, for a sprain or strain, ice is the preferred treatment rather than heat in the first 72 hours. It is also important that you stay active during recovery. Remember that some pain is normal and that avoiding activity because of pain will slow your recovery. Stay positive. Most people with soft tissue injuries return to their usual work, home and recreation activities quickly. Ask your doctor about returning to work as early as possible. Usually there is something at work that you'll be able to do, even if it is not your usual full job. Talk. Ask for help if you are frightened or uncertain about staying active. Talk to your doctor or physiotherapist if you have concerns. Talk with all those assisting you to return to work or sport, and remember that working together will help your recovery. Soft tissue injuries can sometimes flare up from time to time as they recover, but usually settle quickly. You should not be alarmed. It may be that you have done too much too soon.
If you have had a work-related injury, getting back to work as soon as possible is important. As discussed, early communication with your doctor and your employer should assist this process. It has been shown through research that an early return to work on suitable duties doubles the chances of a successful return to work. There is nearly always something that you can do at your workplace, even if you cannot tolerate sitting or standing for too long, or if you can only work for limited hours. So as we have already discussed, returning to work on suitable duties is a critical element to your recovery.
In medical terms, the acute phase of an injury is the first 6 weeks. As you will recall, research indicates that most soft tissue healing occurs in this period. Muscle healing occurs in 4 to 6 weeks and ligaments in 6 to 8 weeks. Of course, some pain in this period is normal, and it is likely that you will return to work or activity in some capacity while you are still experiencing some pain. Pain in the acute or early phase has an important protective role. It makes you move, behave and think differently, so you don't overload the injured body part and encourage it to heal. We have talked about how to manage the injury and pain in this period. Between 6 to 12 weeks, it's called the subacute phase, and by this time, you would expect your pain to have almost resolved. But what if the pain doesn't get better? To discuss this issue with me is Matthew Forster, a pain management physiotherapist.
Soft tissue injuries heal in a similar way in all healthy people. So just because the pain may not be dissipating, doesn't mean your sprain or strain is not healing or already healed. It just means that the focus of your management by your health professional needs to be more active so that you're able to gradually expose your body to a normal range of activity. This may include simulating work tasks in your exercise program. You may also benefit from some education on why, in normal individuals, the pain can persist, the pain system can become super sensitive and can limit you from returning to normal activity. Being away from work for too long, too much rest or inactivity, feeling overly anxious, depressed or fearful of certain activities can all slow recovery. You should talk to your doctor or health professional if you notice any of these things affecting you. Your role becomes central to the team around you to aid recovery in these instances. Remember to regularly progress your exercise and activity level in a sensible manner as your condition improves. Stay positive. Remember your doctor has ruled out other serious illnesses. Ask for help if you are feeling frightened, stressed or depressed. Talk with all those assisting you to return to work or return to sport, and remember that working together will help your recovery. The following picture nicely summarises how the emphasis of your treatment changes if your pain does not settle completely during the active phase following the injury. Initially, you may receive passive care such as hands-on treatment like joint mobilisations and massage, strapping, braces, crutches, ice packs and other modalities aimed at reducing the pain and inflammation. You may even be told to rest. But as time goes on and the inflammation associated with the injury is settling and the healing process is well underway, an active approach to management is essential. Otherwise, you may develop tightness and weakness in the injured tissues, and this can lead to continued deconditioning and will not gently stress the injured tissues in a positive way. Be aware of this change in the emphasis of your treatment after the acute phase.
Let's summarise what we have covered today. Soft tissue injuries are common and include sprains and strains. If you have a soft tissue injury, stay positive. Remember your doctor has ruled out other serious illnesses. Remain active and remember prolonged bed rest and absence from work or your usual activity can cause a loss of physical condition and slow your overall recovery. Pain is common, and with soft tissue injuries, there can be swelling. This can be part of your body's normal response. Early return to work on suitable duties is a key factor for a successful recovery from a soft tissue injury. And because muscle and ligament healing occurs in between 4 and 8 weeks, it is likely that you will return to your usual activity or work in some capacity while you are still experiencing some pain. But what if the pain doesn't settle? Soft tissue injuries heal in a similar way in all healthy people. So just because your pain may not have dissipated, it doesn't mean that your sprain or strain is not healing or already healed. It just means that the focus of your management needs to be more active, such as simulating work or sports tasks in your exercise program. You may also benefit from some education on why, in normal individuals, the pain can persist. Talk to your support team. Ask for help if you are feeling frightened, stressed or depressed. Education about the process is important at all stages of your recovery, and we hope that this program has been able to assist you with understanding how to manage your soft tissue injury.